Duffy Health Center is a federally qualified health center that has a special mission for taking care of people who are homeless or risk of homelessness. We are like any other PCP in the community. You would come here for chronic disease management, urgent care visits. We do a lot with addiction treatment, what we call MAT or medication assisted treatment.
We offer psychiatric care, including psychopharm management. We offer group treatment, individual treatment, and of course we work in coordination with the other departments because this is an integrated care setting.
Case management works really closely with the medical and behavioral health department, so it's really a strong team for our patients. It's just a wonderful thing to see it all come together.
You know, most people think homelessness is just strictly street homeless, but there are a lot of people who are just unstably housed.
So most of the homelessness on the Cape is not the classic street homeless. It's more of the hidden homeless, the people who are living in basements, living in unlicensed apartments, living with relatives, or couch surfing from one house to the next.
I was looking for another sober house, basically, and I had a list of them, and Duffy was on the list under the name of Cindy, and I asked, if there was a room available, and she said, there is one available. I can speak for you at the meeting I'm going to today. And she called me the next day and said, we got a room available, you can come down on Wednesday. This was at the Pilot House, and I lived there for basically 5 years. It wasn't the greatest place to live, but it was, it was a place and it was reasonable and stuff like that. And I had appointments at Duffy. I had a therapist. And I saw her once every couple of months. She was very helpful. I see Sue Waselek every 2 or 3 months, and I'm very happy with her.
The lack of housing really affects people's health care. Chances are health care is going to be a low priority if you don't have a place to live.
Being unstably housed is an incredible impediment to health care. If you think about Maslow's hierarchy, food, security comes before preventative services. People tend to let those things go often way too long because they're just trying to live day by day, make sure there's a roof over their head or something over their head.
Andy Roberts was my case manager, and he was going to the Pilot House once a week to their meeting and stuff like that. And he approached me, I don't remember exactly when, it might have been February of 2016, and asked me if I was interested in housing. And I said, yeah, I'm on a list, but it's going to take years. And he goes, well, I got a program that concentrates on chronically homeless people, which I was considered to be for like 6 years. And he started doing some paperwork with Housing Assistance Corporation, and within a couple of months, they said, you can start looking. I've been there since May of 2016, and so it's going on 3 years, and I'm very happy with my housing.
That was started many years ago by a town councilor, Janice Barton, Rick Brigham, and actually me. And the bottom line to it was, if someone didn't have a place to stay and the weather was bad or there was a medical issue, we would ask towns to contribute so that we could put people in a motel for a few days. The condition of that was the willingness for people to be able to agree and be able to work with the case manager, because we know that that's not a solution, but it's a step towards engagement and possible housing outcomes, reuniting with family, all sorts of possibilities.
I think for our patient population, I really believe one of the common denominators is a history of trauma. So housing stability is not a part of their experience. And if we can help them with housing stability, it's just one step on the road to achieving other goals.
It's a program that allows people to move into housing without having to be committed to working on their mental health issues or their substance addiction struggles, because we believe that it's much better and easier to get things done when you have a roof over your head.
If people don't have that basic level of organization or predictability, it's kind of hard to achieve any other goals.
And I think one of the things that Duffy is a leader in, if I can say that, is trying to, I want to say this appropriately, trying to get the shame away from the stigma of being homeless or, struggling with addiction and mental health, because every case is different, and I think there are a lot of really lovely people who struggle.
I don't know. I'm just really happy, and I don't know where I'd be if it wasn't for Duffy. I really don't.